Hi guys, it's me again, your girl, Miss Mo. And so, in my previous video, I told you we're gonna continue the parenting series, and so we are back on it again. And today, I'm going to talk about some of the interventions or the therapies you can have, some of the people you can see to help you should your child be atypical, okay? And so, I'm going to focus on 5. There are actually a lot of therapies you can have. But then for now, I'm going to focus on 5, and you can go back and read more on it. Or if you want me to do something else, you can actually, get back to me on it, and I will sure, give you something juicy about whatever it is that you would request for, okay? So the first therapy you can have if your child is atypical is behavioral therapy, and they focus more on challenging behaviors, okay? So every child, whichever behavior they show, whether it's appropriate or inappropriate, there is a reason. There's always a reason why a child will do something. So assuming you are probably sitting down and your child will just come and hit you and start laughing, there's a reason the child is doing that. The child is hitting you and laughing for a reason, okay? And so this behavioral therapist would help you to understand the behavior, the challenges, and what to do about it, how to help your child, behave in the appropriate way that would fit society, okay? Now we have speech therapist or speech therapy. So the therapist is the person, the therapy is what you are going to do. And for them, usually they focus on verbal directions, social cues, conversations, turn-taking, asking and answering questions. These are some of the things they focus on. But there are other broader things they do. So if you have a child who is delayed on speech, it's very important you see a speech therapist to help you. Then we have the occupational therapist. Usually when we say occupational therapy, people think, okay, is it related to job? Are they going to help me find a job? Are they going to help me adjust to my job? No, there is more to occupational therapy. And actually, I have a surprise for you when it comes to occupational therapy. But for now, let me just, focus on what I'm doing. So they help the child to become more independent in their daily life. So everything that is, involving life issues, life skills, that is what the occupational therapist will do. And then there's another subfield under occupational therapy, which is sensory integration therapy. They focus more on the senses. If you go back to my earlier videos, I actually spoke about the senses and what it does, and if a child is having a challenge with each, what you should actually pay attention to. And so that is what this therapist will help you. So if your child probably has an issue with balancing, with tasting, with noise, okay, with light, everything about the senses, this is the person you should see. And the final one is social skills therapy. So they help the child with getting along with group settings, with social gathering. That some children that you take them they are home and they are all back home, but then you take them to church, you take them to the playground, and they are so isolated. They don't be touched. They don't want to be among people. It is actually something that can be worked on. And so these are the 5 I'm actually going to focus on in my next video, probably the next one. I'm not sure which one. I have a surprise for you. I'm going to do something that we have not done on our channel yet. And so if you really want to know what the surprise is, stay tuned, subscribe, so that whenever I post something, you will get it. Thank you so much for following me up to this point. We are still in the parenting series, but with the next video, I'm gonna give you something else, okay? Something other than the parenting series before we continue. So thank you so much. Don't forget to like, don't forget to comment, don't forget to share. And discoveries, discover and learn.